Section 2. Strengthening children's resilience to climate change. Section 2 provides an overview of how children's resilience to climate change can be strengthened through adaptation and disaster risk reduction interventions. Resilience is the ability of an individual, community, society or system exposed to a threat to resist, absorb, adapt and recover from its effects in a timely and effective manner. In the face of unavoidable impacts for the next generation, child-centered adaptation is a necessary element of the global response to climate change. With millions of children at increased risk from infectious diseases, malnutrition, water scarcity, disasters, and the collapse of public services and infrastructure, the response to the threat of climate change demands investment in child-centered adaptation. Adaptation refers to the process of adjustment to actual or expected climate and its effects. It includes any spontaneous or planned action taken to cope with the impacts of or reduce vulnerability to climate change. As such, adaptation represents a whole set of activities, from introducing alternative livelihoods that are not as dependent on natural resources to modifying agricultural practices to be better suited to a drier climate. Child-centered adaptation specifically focuses on the needs and vulnerabilities of children. A child-centered approach to climate change adaptations means focusing on the specific risks faced by children in a changing climate, ensuring that children's needs and capacities are central to adaptation planning and implementation, increasing the voice and agency of children in adaptation decision-making processes, therefore protecting children's rights, such as the rights to life, safety, participation, and development. The ability of children to reflect, make their own choices and decisions on issues affecting them, and have control of their lives. There are two aspects of child-centered adaptation. Adaptation for children, where the capacity of caregivers to focus on children's needs and capacities is enhanced, and adaptation with children, where children are centrally involved in the decision-making, planning and implementation of adaptation at all levels. A child-centered approach to adaptation recognizes that children are much more than passive victims of climate change. They are powerful agents of change. Furthermore, given that children's needs and capacities differ across age, gender, geography and socioeconomic status, child-centered adaptation ensures that all children are able to meaningfully participate in the adaptation process and no one is left behind. Disaster risk reduction, DRR, and children. Climate change impacts are projected to increase the numbers of children affected by disasters to 175 million per year in the coming decade. DRR aims to minimize vulnerabilities and disaster risks in order to avoid or to limit the adverse impacts of natural hazards, while also covering non-climate related disasters, for example earthquakes. DRR is recognized as a key climate change adaptation strategy. Disaster risk reduction, DRR, is a systematic approach to identifying, assessing and reducing the potential losses which could occur to a particular community or a society due to the impact of a natural hazard. Thus, it is important for protecting children's rights, such as the right to life, the right to protection from violence, abuse and neglect, and the right to have knowledge of their own culture and origin. Watch the video to learn more. Amir, 14, is a member of the children's organisation and slum volunteer of Pora Slum in Jatrabari, located at the southern part of Dhaka, Bangladesh. His community is particularly at risk from waterlogging, floods and fire. After being trained in first aid and fire safety, he has been working on disaster risk reduction. Amir has contributed to saving the life of a person living with disability during a fire. Furthermore, he raised awareness of DRR amongst his friends, family and neighbours through drama, courtyard meetings and the distribution of posters and leaflets, which resulted in concrete changes in behaviour. Mainstreaming child-centred adaptation into development. Children are a key part in the identification of risks and resilience-building options for development programs. Children's specific needs and capacities are included in the vulnerability assessments and planning processes for climate-smart development. Children are included in the processes of monitoring and evaluation of programs and initiatives that affect them. Given the interlinkages between climate change and poverty, measures to improve child well-being should take into account the impacts of climate change. By mainstreaming adaptation into development processes, governments at all levels can integrate risk reduction and resilience building into development programs across all sectors. Children and climate change planning. Child-centered approaches to adaptation also need to be included in local, sectoral and national climate change planning processes. To do so, existing adaptation policies, guidelines and strategies could be reviewed to ensure that children are visible, their rights are being respected, and the root causes of girls' and boys' vulnerability are addressed. Newly developed plans, including new climate change strategies and national adaptation plans, NAPs, could include child-centered approaches and ensure that children's rights are integrated into policy implementation. Prioritizing action at the local level could be particularly relevant, and this is where adaptation needs are the greatest and vulnerable people will be most affected. The two publications, National Adaptation Plans, the Technical Guidelines for the National Adaptation Plan Process, include guidelines for the formulation of NAPs through 4 steps. They aim to assist countries to develop clearly defined adaptation programs. They include information on how to integrate a gender perspective into the NAP process. WASH Climate Resilient Development, the strategic framework for WASH Climate Resilient Development, provides water, sanitation and hygiene WASH sector practitioners with guidance on the main elements to be considered in the planning and execution of actions aimed at building climate resilient WASH services. The principles outlined in the framework aim to complement and strengthen ongoing national and sectoral adaptation planning processes. It includes a focus on women and children. Case study: developing a climate change response in collaboration with children. Climate change represents a real threat in Zimbabwe. In order to address it, in 2013, the government of Zimbabwe prepared the National Climate Change Response Strategy. Children and youth were invited to participate in the consultative process for its development. Through multiple workshops, youth and junior parliamentarians highlighted the issues affecting them that they thought should be included in policies and planning for climate change. These outputs were combined with those from a specific children and climate change study undertaken by UNICEF and the Institute of Environmental Studies, IES, and then incorporated into the National Climate Change Response Strategy as a stand-alone section on children and youth, as well as in other appropriate sections. Benefits of child-centered climate change adaptation. Effective child-centered adaptation measures exist for all priority areas for children. Explore more by clicking on the circles: health, WASH, education, nutrition, protection, inclusion. We've done this for you. The implementation of a child-centered approach to adaptation can provide multiple benefits for children. Many measures are already well known and are also some of the lowest cost measures available. Investments in key priority areas for children can be particularly important for strengthening their resilience to climate change, addressing the risks highlighted in Section 1. Priority areas include health, including HIV and AIDS, WASH, WASH, education, nutrition, child protection, social inclusion. Humanitarian action, gender equality, and human rights cut across all of them. Focus on health. Improved access to emergency health services decreases deaths and injuries from disasters. Heatwave early warning systems and appropriate advice help reduce the incidence of heat-related illnesses. Improved access to anti-malaria treatment and mosquito nets limit the spread of vector-borne diseases. Surveillance systems that collect information on epidemic-prone diseases in order to trigger prompt interventions. Child-centered adaptation interventions in the health sector help to strengthen girls' and boys' resilience to climate change by addressing their health risks as well as those of their caregivers. Promoting improved access to health treatment is particularly important for the survival and well-being of children living with HIV/AIDS, who are at higher risks of infections, and children with disabilities. These measures enhance children's right to health, which is still limited for many of the world's poor. Lowat Emmanuel, 10, lives in village, Kanawat, Uganda. In Kanawat, less than 1/3 of residents have access to clean water, a situation that is compounded by climate-related disasters such as drought and flooding. This combination of factors provides a dangerous breeding ground for epidemics. UNICEF has been working in partnership with the government and private sector partners to protect children's lives in this community by providing clean water through the introduction of solar-powered pumping systems, which are resilient to climate shocks and stresses as well as being climate neutral. As a result, 3,480 children have received uninterrupted access to safe water in 5 villages, including in schools and the local health centre. A significant reduction of waterborne diseases such as diarrhoea has been observed. Focus on WASH, achieving universal access to sustainable and safe water and sanitation, is a human rights concern, key to child survival and well-being. However, as the global water cycle is directly affected by climate change, solutions to people's access to safe water, sanitation and hygiene, WASH, can be significantly affected by extreme events such as floods and droughts, as well as growing water scarcity. The slide shows 4 innovations, best practices in building climate resilience, which can greatly benefit children and their families by increasing water quantity and quality and promoting improved sanitation. Case study: improving water access for conflict survivors in the Central African Republic. Strong climate change impacts in the Central African Republic exacerbate the dangers from protracted armed conflict for 2.14 million children. Widespread violence and large-scale human rights abuses have led to the displacement of 850,000 people. In this context, UNICEF is implementing an innovative climate-sensitive manual drilling program to provide access to clean water for internally displaced people, offering multiple social, economic and environmental benefits. As a result of this program, 5,000 internally displaced people, including 2,000 children, have been provided with access to safe water, and 50 young men and women, including former child soldiers, have been trained in manual drilling, providing them with new work in their communities. 10 water points have been constructed, and the creation of an additional 30 new water points is underway. The water stress on deep groundwater reserves in the area has also been reduced. This initiative is an example of climate-sensitive humanitarian assistance. Applying a climate-sensitive lens to humanitarian interventions is an important element for reducing children's vulnerability to the impacts of climate change. Focus on education. Structural measures for schools to withstand impacts of disasters can protect children and their right to education. School-based programs on early warning systems enhance disaster preparedness. Youth-led community risk mapping enhance their involvement and awareness. Education is a right which allows the full exercise and enjoyments of other rights. Education protects the well-being, promotes learning opportunities, and supports the social, emotional, cognitive and physical development of children and youth. Therefore, the education sector can play an important role in situations of disaster risk and climate change. In terms of learning, education is central to the development of the knowledge and skills to manage risks and adapt to changes. Further information on climate change education is available in Section 4. The right to education includes physical security. Climate change proofing of educational infrastructure is key. This minimises the risks and associated costs of weather-related damages and promotes adaptation, making schools a safe space for children to learn and play. Vola, 10, lives in the village of Mahatera in Madagascar. Mahatera is vulnerable to repeated and destructive cyclones. Each year, schools in the region, built with local materials, are completely or partially destroyed and require reconstruction. In Madagascar, it is estimated that 1,200 classrooms are damaged or destroyed each year as a result of extreme weather. Since 2008, UNICEF has been building cyclone-proof schools using cinder blocks or pressed bricks reinforced with metal frames. The new schools also have access to climate and disaster-resilient water systems and gender-segregated latrines, essential for preventing disease in emergencies and providing a healthy and protective learning environment. At the same time, teachers and students in over 13,000 schools are being trained in disaster risk reduction and preparedness. Focus on nutrition. Crop diversification increases food security and livelihoods. Distribution of fortified food and promotion of breastfeeding are key sources of nutrition for children in emergency and disaster situations. Community gardens ensure that children have nutritious food and a better balanced diet. As climate change is projected to have significant impacts on the agricultural sector and on water access, as well as cause loss of livelihoods, access to adequate nutrition is set to worsen as impacts intensify and the incidence of extreme events increases. Children are particularly vulnerable to climate-related food insecurity, with millions of children around the world struggling to get sufficient nutrition in their daily diet. Child-centred adaptation interventions intend to reduce malnutrition of children and their caregivers, as well as enhance families' livelihoods. This will help realise children's rights to adequate nutrition. Case study: diversifying agriculture in Nepal. Children in Julma, Nepal, suffer from acute malnutrition. Increasingly irregular rainfall, extended droughts and flooding have contributed to crop failures. Since 2003, World Vision Nepal has been working with local communities to help increase food security and nutrition outcomes for children. Interventions are intended to improve land management, maximise agricultural diversity, change consumption patterns, and develop surplus management programmes. Key activities implemented to date include terracing mountain slopes to increase the amount of land available for agricultural production, construction of greenhouses to raise tree saplings and increase the duration of the growing season, increasing use of compost and seed saving to ensure the viability of newly established apple orchards, more suitable to changes in the weather, construction of cellars to safely store apples before they are transported to market, improving roads to increase reliability of access to markets. Focus on child protection. Psychological and social support can help children to recover from disasters and cumulative shocks. Safety net interventions help to prevent dislocation and exploitation of children. Providing water closer to homes keeps girls safe from abuse and boosts their school attendance. Protection involves defense of human rights and the protection of life, dignity and integrity from the effects of violence, coercion and deprivation of liberty in situations of crisis or affected by the impact of a damage generator event. Adaptation interventions promoting child protection in the face of climate change address both the physical and psychological safety of children, taking into account the different risks for girls and boys. They aim to limit children's exposure to exploitation, abuse and trafficking, and to support them in dealing with traumas. Mariama, 10, lives in a village in Guinea-Bissau. Like the other girls, she used to walk long distances to fetch water. Under the threat of climate change, this distance could have increased due to water scarcity. Such situations can put young girls and women at risk of sexual violence. With UNICEF's support, fetching water is now much easier, and girls like Mariama have more time to dedicate to attend school. Focus on social inclusion. Child-sensitive climate budgeting and programming. Cash transfers after natural disasters strengthen social protection systems. Education and health service fee waivers ensure wider access to key services for poor girls and boys. Social exclusion stands in the way of children's well-being all over the world. All children, like adults, have a right to an acceptable standard of living, access to social services, and to a life free from bias and stigma. Child-centered adaptation interventions for promoting social inclusion focus in particular on poverty and discrimination, which are exacerbated by climate change. Case study: cash distribution in Niger. Because of decreasing rainfall, crop yield in Niger has been very poor. Mothers with children between 6 and 23 months old were already receiving monthly rations of enriched foods from UNICEF, but it was not enough. The most food insecure households have been further supported with a cash transfer system. Watch the video to learn more.
You're watching UNICEF Television.
An shi za mu ci kawai ɗanɗa bai hiba wata biyu ko uku. Da na rako sussuka shi na ga bakin yanayin shi na yi muka yi abinci da shi. Da na sussuka shi na auna shi duka bai hiba cikin wannan tiyal biyu ya muka yi tuwo.
A gaban ido sun gane an tuɗa ta suna kallo. Allah ya taimaka halana. Gayi suna aiki an gani. Gayi suna aiki mun gani. Suna rika gane komai. Yau gari ya daji sun gane matsalar komai. Gari ya daji sun gane matsalar gona. Sun gane matsalar gona sun gane matsala ta gida. Saboda ko'ina sun gane sun duba matsala gaskiya. muka gero farko kwariya lalata shi muka shuka wacen farko kwariya lalata shi banmu da takin gargajiya.
We would like that women play a role in the family. They are a mother, they have these kids, and they are responsible for these kids. They are one who are struggling for food, to nourish to feed their children. And we would like to empower these women.
Yaɗiya, kauti, wani an kaje ka lalimo a da, wani kasan ɗan kunu shine ake ƙwarawa, ake bai yara, an bai isa ba yaɗiya. Sai a ce a yi ɗan kunu, yara kuma ku je ku kawo yaɗiya a dawa ta baka da ɗan kuli da manda da barkono. An aka ci kuma wani ɗan kunu kaman horau-horau ne, sai a ɗora, kuma halin sai a kwanta hegu. Muka aka ba mu kuɗi, lal a ba mu kuɗi ma bai kwan ba a hannu. Sai muka bai mai gida ya tafi kasuwa ya sayo haɗi, da ya sayo haɗi sai aka kawo, sai ya sa ɗaki, da ya sa ɗaki ka san gida da yaro da yawa za ka ɗauka tuwo da hura ka riƙa yi abin da baka saba ba, da kana ɗan kaɗan hana ana malmatse a ciki, to haɗi ya zo ka bari cikin yaro ya yi tsawa ya yi yunwa, kake kwasa kawai tiya zaka uku kawai ka rubde shi a turmi ka daka kowa ya wadata. Nasara ya wanke mun ji daɗi. An bai ɗana kashi. Yi aiki. Yi aiki ke ɗauke ki dai. Yau kuma. Ija ni. Inda ke leluwa. Auto zuce. Mai zirgi zaune. Mai malawa zaune. Inda leluwa. Dama sun gaji kenan. Ko daure. Ko daure babu. Ɗauka.